Hello friends, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. As you know, I make videos on health and healthcare topics and I give you simplified, very simple and very authentic information which is directly referenced from internationally accepted US National Medical Library, so you can trust this information. And today I'm going to talk about belching, bloating and flatulence. We are going to talk about what causes belching, what are the most common reasons why you can have bloating, why you can have flatulence, and what can you do about it. So there are so many people who have these problems, one or the other, and they are suffering from these issues because of either their diet, the way they eat, or their lifestyle issues. And there are very small things which you can actually do, which can actually relieve you from all these issues and which can save you from a lot of social embarrassments. So let's talk about all these things, why they are caused and what you can do about them.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
So first of all, belching. Belching is also called as Dakar Ana in Hindi. So belching is basically caused by swallowing air, actually swallowing air, or if there is a lot of air which is created inside your stomach. So inside the stomach, not intestine. So if there is a lot of air inside the stomach, it comes out with the sound. So why would there be air? The first and most common reason is eating or drinking too fast. Yes, if you drink or eat too fast, or if you don't chew your food completely, then you have a tendency to actually swallow air with it. Then if you have a poorly fitting denture, then if you take a lot of carbonated beverages, a lot of Pepsi, Cola, whatever you drink, if you eat a lot of chewing gums, or by sucking on a hard candy, that also sometimes you can take inside, you can take air inside, you can swallow air. Then many times there is stress, tension, nervousness, because of which people excessively swallow. This also takes in air. Then if you have a post-nasal drip, a nasal rhinitis, that means if you have a nasal allergy and because of which there is a dripping fluid or mucus behind from the nose into the throat, what happens? One, you will have cough. Second, you will have swallowing reflexes, excessive swallowing, and you can swallow air with it. Many times there is a lot of abdominal discomfort and people try to force the blenching. These are all the causes of belching. So how to prevent this belching? First of all, avoid carbonated beverages. No Pepsi, no Cola, no chewing gums, no hard candies. Sometimes what can help is simethicone containing syrups. Syrup containing simethicone can help. So that's what you can do to prevent belching. Nothing else, nothing major needs to be done. Sometimes antacids can be taken. Any over-the-counter anti-acid syrup or anti-acid tablets, capsules can be taken. Then second thing, bloating, abdominal bloating, discomfort. Sometimes you feel there is a lot of fullness and distension in the abdomen. This happens because the intestines are getting filled with air, and mostly this is because of intestinal sensitivity to certain food products, and mostly this is because of intestinal sensitivity to certain food products, and sometimes it can be a symptom of irritable bowel syndrome. So what are these food products which are more likely to cause abdominal bloating, and more likely that many people are having increased intestinal sensitivity to these food products? What are these food products? First is broccoli. Broccoli can have that effect. Baked beans, cabbage, carbonated drinks, cauliflower, chewing gums and hard candies. So these are the things which can have a abdominal bloating effect because of intestinal sensitivity. So what can you do? Avoid all these things if you have that problem. Then there is another reason why you can have abdominal distension. It can also be because of weak abdominal muscles. If your abdominal muscles are very weak, what will happen? In the morning you will be better, you'll feel thin, but by the day progresses, you will feel that you are getting fat, your belly is coming out. Then if you lie down, you feel better. If this is happening, what you need to do is you need to try and tighten your abdominal muscles by pulling in your stomach several times during the day. And you can do sit-up exercises if possible. And obviously you can wear an abdominal support garment. If your exercising is not possible, it's too difficult then. So that's all you can do for abdominal flatulence discomfort. And obviously you can try antacids for them. Then flatulence. Flatulence is passing gas through the anus, and this gas is created through the bacterial action in the bowel, and it is passed rectally through the anus. But keep in mind that 10 to 18 passages per day means if you pass gas through the anus 10 to 18 times, it's normal. Yes, it is normal. Primarily, the gases are very harmless and sometimes odorless. Noticeable smells or bad smells are the trace gases which are related to food intake, depending upon the food which you are taking. There is nothing much which you can do about flatulence, but yes, there are some likely food substances which are more likely to cause such kind of gas, and you can avoid them. First is milk and dairy products or medicines that contains lactose. What happens if your body doesn't produce the enzyme lactase to break it down? You will have a lot of gas production inside your intestines because the lactase will not get digested in the upper intestine. In the lower intestine, it will get digested by the bacteria. So you will have a lot of flatulence. So milk and dairy products are one of the important reasons. So you can try avoiding them and see if your flatulence decreases. Second are vegetables, certain vegetables like baked beans, cauliflower, broccoli and cabbage. So you can try decreasing or avoiding these. Then starches, sometimes some starches like wheat, oat, corns and potatoes. Sometimes these also cause flatulence, a lot of gas. So in this case, rice is a good substitute for these starches. So if flatulence is actually a big concern for you, then you need to see a doctor and determine if you are actually lactose intolerant. That is an important thing which you can do. And obviously you can identify the offending foods and reduce or eliminate these gas forming foods from your diet. That will solve your issue. Right? So these are my tips for you for flatulence, belching and bloating. I hope you've understood the points, and obviously you can pass this information to your friends if someone needs it. And you can try out all other videos in my channel. These videos also give you a very authentic and simplified explanation about the most common health topics. And if you like the videos, then do subscribe my channel and hit the bell icon. Those who don't know me, I'm a consultant physician and cardiologist in Yashoda Superspeciality Hospital, Nehru, Nagar, Delhi NCR, and this is my channel. Till next time, keep watching my videos. I upload them on a daily basis. Stay connected, stay healthy. I'm going to give you 10. There are so many periods, one or the other. Save you from a lot of social embarrassments. The Dakar which you do. So belching is basically closed your behind from the post behind. These are all the causes of belching of belching.